Hello, my name is Carl Moeller. I'm the Executive Director of the Campaign for Public Health Foundation, and today we wanted to walk you through some slides to talk about the size of the CDC's budget in comparison to federal health spending. The first site we'd like to visit for you today is the White House website, the OMB, or Office of Management and Budget. So the White House, when they put out their 2012 budget proposal, launched a pretty interesting application on their website that's an interactive display of what percent different parts of the federal government constitute. So for example, you can look at the green boxes here, which are healthcare, and they account for 22.6% of federal health spending. Social Security, meanwhile, is 20% of federal health spending, and defense is actually less than that at 19.2%. In this presentation, we'll just focus on health. And so Medicaid and the Children's Health Insurance Program, Medicare, are both mandatory spending. In other words, they're locked in by law, and Congress doesn't have the discretion to change those levels at any point in time. They would need to pass and amend existing laws for those programs. And the same is true, obviously, of Social Security. So discretionary spending for health is down in this small section down here. The next slide will take you to on the Budget Committee's website in the House of Representatives. They have a March listening session slide deck that they've posted there. And again, they have a pretty similar breakdown of the federal budget based on 2010 funding. And what's interesting about their presentation is they break it out into discretionary spending and mandatory spending. And you can see that the larger part of the pie is mandatory spending, Social Security, Medicare, Medicaid, other mandatory programs and interest, and then defense discretionary, and then non-defense discretionary. Now this is a pretty broad topic and actually would include now those two boxes of health discretionary spending that were on the President's earlier slide, including NIH, CDC, and other health agencies. A final thing we need to talk about when talking about federal spending is federal revenues, and that is this dark black line here that follows across this chart. Now revenues, of course, are just income from taxes that are coming in the door. This is a chart that was published in the New York Times back in 2009. But they, at the time, were projecting fairly level tax policies. And you can see that Social Security and other spending really were fairly level, but Medicare and Medicaid accounted for the vast majority of the increase in spending moving forward. And they go on to quote the Congressional Budget Office that spending on Medicare and Medicaid, driven by the aging population and the rapid growth of per capita health care costs, will account for most of the projected growth in primary federal spending for the next 25 years. An interesting note on that is that 70% of our nation's health spending is spent on things that are preventable. So this slide is chopped out into Medicare, the largest part of that spending, Medicaid and the Children's Health Insurance Program, and then discretionary spending on health, non-CDC discretionary spending. This would be the National Institutes of Health, FDA, HRSA, and other federal health agencies, and the Centers for Disease Control and Prevention here at $6.5 billion is the remainder of the discretionary budget. How big is the CDC? And the first way to look at it is what is the CDC as a percentage of all federal health spending, and you can see it's 0.79% of federal health spending. That's about 0.8%. Another way to look at it would be that the CDC's budget is 0.18% of all federal spending, and that's less than 0.2%. So the point here, I think, would be that we don't have a deficit crisis because we're spending too much on the prevention and control of disease. We hope that this presentation has been helpful in giving you a sense of how the CDC's budget fits into overall health spending and the overall federal budget. Thank you.